diabetes service.
Thank you for the organizing for such an honor to be able to present my study. In this study, we will evaluate in type 2 diabetic patients the influence of meal timing on postprandial glucose, insulin, and incretin response along the entire day. As we know, the deficiency of early prandial insulin response is the major defect in type 2 diabetes. It contributes to postprandial hyperglycemia that is associated with cardiovascular risk in type 2 diabetes. Because of that, the reduction of postprandial hyperglycemia is the major target in the treatment of type 2 diabetes. Recent guidelines from ADA and ESAB recommend that 2 hours post-meal glucose should not be above 180 milligrams per deciliter. Accordingly, dietary modification focused on the reduction of postprandial glycemic excursions along the day are needed. Nowadays, the guidelines for the reduction of postprandial glycemia, namely, are advised the intake of low glycemic index food. However, neither of these guidelines take into account the circadian rhythm or variation of postprandial hyperglycemia along the day. The glucose metabolism is controlled by endogenous circadian clock, conformed mainly by the master clock controlled by light and the several peripheral clocks controlled by meal timing. These peripheral clocks regulate the circadian secretion of insulin, adiponectin, leptin, ghrelin, etc. The time of the day of the food intake interacts with most of the peripheral clock genes, including those expressed in the beta cells and in the skeletal muscle that regulate the circadian rhythms of insulin secretion and the circadian rhythm of the insulin-mediated glucose uptake, driven by this mechanism the diurnal variation of postprandial glucose. We know that the postprandial glucose and glucose tolerance is subject to circadian rhythm, with more prolonged and higher postprandial glycemia in response to identical meal in the evening than in the morning. We therefore hypothesize a breakfast diet with high caloric intake in the breakfast, just when the glucose tolerance is better during the day, we reduce postprandial glycemia throughout the day, compared to the dinner diet with the inverse meal timing schedule. With this hypothesis in mind, recently reported in metabolic syndrome that those subjects that followed the big breakfast diet with higher calories in the breakfast resulted in significantly lower glucose excursions during the day. And in type 2 diabetic subjects, more recently we've documented a significant decrease in hemoglobin A1C. However, in this study we didn't explore the postprandial incretin, insulin, and glucose after breakfast, lunch, and dinner. Therefore, in this study, in the present study, crossover design in type 2 diabetic patients, we randomize the patient to all-day meal test, either with the big breakfast diet schedule or the dinner diet schedule, and after washout, they cross over to the all-day meal test with the opposite diet. The samples were taken from 0 to 180 minutes after breakfast, lunch, and dinner for glucose, insulin, GLP-1, and appetite scores. And then we compared Over the entire day, we compare also the response to high-caloric breakfast versus isocaloric dinner, and then we compare isocaloric lunch once preceded by high-caloric breakfast and once preceded by reduced breakfast, exploring, assessing the second meal phenomenon. The patient was 18, the body mass index 28, the hemoglobin A1C 7.6, the time since diagnosis of diabetes 9.3. You see here the composition of the diet. The lunch was exactly the same, and the high caloric intake in the breakfast was assigned to the breakfast diet, and high caloric intake in the dinner was assigned in the dinner diet. We see that plasma glucose throughout the day was significantly lower in the breakfast diet in pink. The glucose response after high caloric breakfast was significantly reduced, and we can see that 2 hours post-meal glucose was 163 after high caloric breakfast, which is quite below what below the 180 recommended by ADA and ESD, nourishment guidelines. Also, the glucose response was significantly reduced after high-caloric breakfast when it was preceding the lunch. When lunch was preceded by high-caloric breakfast, the response, the postprandial response of glucose was significantly lower. The plasma insulin throughout the day was significantly higher in the breakfast diet, and you can see here the early insulin response was significantly higher after high-caloric breakfast than after isocaloric dinner. Similarly, after isocaloric lunch preceded by high-caloric breakfast, the early insulin response was significantly higher. Similarly, glucose GLP-1 throughout the day was significantly higher during the breakfast diet, and the response, postprandial response of GLP-1 was significantly higher after high-caloric breakfast than after high-caloric dinner. The isocaloric, during the isocaloric lunch, that preceded by high-caloric breakfast, result in high-caloric, high GLP-1 response in comparison to the lunch preceded by reduced breakfast. Similarly, in the hunger, we observed that the hunger was significantly reduced in the breakfast diet, and there was greater suppression aspect of hunger after high-caloric breakfast, and also was greater suppression of hunger after isocaloric lunch preceded by high-caloric breakfast. In summary, the overall the day breakfast diet versus dinner diet reduced glucose over all the day, increased the insulin throughout the day, increased the GLP-1 and reduced hunger. When compared high-caloric breakfast versus dinner, it resulted in reduced postprandial glucose response, higher and faster early insulin suppression, higher 3 minutes and 180 minutes worth response of GLP-1, a greater hunger suppression. And when we compared the lunch preceded by high-calorie breakfast and that preceded by reduced breakfast, we see that the preceded by high-calorie breakfast reduced the glucose response, display higher insulin secretion, increased the GLP-1 and reduced hunger. In conclusion, this study supports the potential diurnal pattern of postprandial glycemia, incretin secretion, and the beta cell response to incretin. Also support the possible role of secondary phenomena in the beneficial effects of glucose, incretin, beta cell response to lunch when it's preceded by high-calorie breakfast. suggesting that high-calorie intake in the breakfast with reduced dinner might be beneficial alternative for management of postprandial hyperglycemia. Meal timing and distribution should be considered as therapeutic strategy in type 2 diabetes. I thank my team in Israel and Professor Boaren, who all of them made possible the conduction of such study. Thank you very much.